Assalamualaikum and good morning. I am Nufakrina binti Marizam, and today I'm going to present about my case study in what I do for my thesis, which is the relationship between mental health and planning in urban area, which is in my case, the case study that I study is at Kota Baru. Okay, for the purpose and aim for this study is to evaluate how the planning in an urban area can affect one's mental health through evaluating the environmental planning in Kota Baru and the residents of Kota Baru's mental health and their human behavior. In my study, there are three problem statements that this study wants to tackle. First, which is the lack of specific government policy and authority that are needed to tackle this problem, which is mental health problem. The WHO stated that almost 40% of countries that don't have any mental health policies and 30% countries that don't even have mental health program. And secondly, the rates of people that live in urban area have a higher rates of mental health problems. That is because in urban area they have to face the common risk factor of increasing stress level and depression. Okay, lastly, the last problem statement in this study is because there are not enough attention on this topic in Malaysia. Even if there is, there are only by researchers, scientists, socialists that are normally doing this kind of study. But then because of the lack of attention by the authority and governments, that's why the amount of mental health patients, mental disorder patients are getting higher by year. Okay, for chapter 2, which is the literature review, I studied about the principle and the criteria of mental health and planning, about how mental health and planning give impacts on society and everything, and also about how the practice of mental health and planning takes in Malaysia, and also about what is the guidelines and policy of mental health and plannings that the world already have globally, and also about how the mental health and planning guidelines and policy in Malaysia. Okay, for research method, I used the method of questionnaire or survey. For respondent, I decided based on the calculations that this study needs 106 respondents, and these respondents were given questionnaires by Google Form, which is online, because given by the situation right now that it's not easy to get respondents out there. So by using Google Forms, 106 respondent was successfully got lah. For findings, there are 4 findings that this study have gotten out. So the first finding is that Kota Baru is indeed a livable and a good city to live. This is because when a question asked in the questionnaire about how agree the respondents are in the level of 1 to 5 about they are happy living in Kota Baru, and majority of the respondents answered 4 and 5, which is they agree and very agree that they are indeed happy live in Kota Baru. For the second findings, it is turned out by this study that Traffic management and planning in Kota Baru is one of the main issues that contribute to mental stress for the residents, because based on the data, which is 61% of the respondents from 106 people actually unsure and disagree with the statement that Kota Baru has a good traffic planning and management. And based on the recommendations of respondents, a lot of them actually recommended that Kota Baru improve their traffic management and planning. Okay, for the next finding, the third one is Kota Baru has insufficient recreational park and open space. This is based on the data by the respondents. Above 50% of respondents, which is what they want to improve in Kota Baru in terms of mental health, and almost 40% of them wants the respondents disagree that Kota Baru has a sufficient recreational park and a good planning. This is also backed up by the recommendations by the authority to add a new recreational place and open space. Also, based on the questionnaire and the data that this study has gotten, the respondents was asked if they want to stay in Kota Baru or move out, but the majority choose they want to stay in Kota Baru, and this has proven that Kota Baru planning is insufficient in some way, which is like traffic planning and management, but in other perspective, such as they have a good neighborhood, they have great facilities, and the accessibility to school, between school and place of work and their home is great. So through the findings, there are a few improvements that are made, which is to improve the planning guidelines and policy about mental health and planning, and to add additional recreational park, preferably pocket parks, because Kota Baru is a dense area. And lastly, to for the enforcement of traffic planning and management in Kota Baru. So in conclusion, these recommendations helps related individuals or authorities in improving and enhancing the planning standards and guidelines of the mental health planning and its relation to town planning itself.